I'm Tyrus.
I'm Liz Clayman.
I'm Greg Jarrett, and this is the Fox News Rundown.
Friday, May 14th, 2021. I'm Lisa Brady. If you're fully vaccinated, you can stop wearing a mask most of the time. New guidance from the CDC that's been a long time coming.
When you see people wearing masks indoors, it's illogical. And I think right now you're seeing a political establishment saying, look, if we continue along these draconian guidelines that we put out, we're going to lose all the credibility of the public.
I'm Chris Foster. The news on jobs has been mixed lately, with fewer jobs created last month, but fewer people being laid off from the jobs they have. In some cases, employers can't find anyone to hire.
Look, there are obviously problems, and when you've had this severe a public health crisis and you've had this severe an economic crisis, you're going to see bumps.
And I'm Tammy Bruce. I've got the final word on the Fox News Rundown.
After more than a year of wearing masks, this is music to the ears of millions of Americans.
Once you are fully vaccinated, 2 weeks after your last dose, you can shed your mask.
The CDC director, Dr. Rochelle Walensky, says that means doing the things you had stopped doing because of the pandemic. Outdoor and indoor activities, large and small, without a mask and without social distancing.
We have all longed for this moment when we can get back to some sense of normalcy.
In the Rose Garden a few hours later, an unmasked President Biden hailing the announcement as a great milestone, and he credits Americans for doing what he calls their patriotic duty, encouraging others to follow.
After a year of hard work and so much sacrifice, the rule is very simple. Get vaccinated or wear a mask until you do.
The CDC also says if you're vaccinated and are exposed to COVID, you don't have to get tested. However, any federal, state, or local rules still apply, including businesses that require masks or workplace rules for employees. And even for fully vaccinated people, the CDC still recommends a mask in crowded indoor settings, including buses, airplanes, and hospitals. But things like getting a haircut, going to a movie, the gym, bars and restaurants, or attending church, even at full capacity, are now considered safe without a mask if you're vaccinated.
The CDC and the Biden administration, and they're one entity, they're responding to public frustration.
Dr. Marty McCarry is a professor of surgery and health policy at the Johns Hopkins University School of Medicine, Fox News medical contributor, and author of The Price We Pay.
Right now, people get really angry, and they're angry at outdated guidance and their outdated restrictions that they know are not based on science. So what you're seeing is a response to public frustration. When enough of us are out there on a number of platforms pointing out how there's no science to support these restrictions, I think you're seeing a political establishment right now worried about re-elections.
Well, and at the very least, the president did acknowledge, or seemed to acknowledge this week, that it's, if you want to give an incentive for more people to continue to get vaccinated, then let them know they won't need the mask.
That's right. Telling people they need to wear masks indoors or kids need to wear them outdoors contradicts every other message we're sending, and that is the outdoors is safe. It dissipates the aerosolized virus instantly. The risk outdoors is minuscule. And it really sort of undermines the ability of people to trust the vaccine, because vaccine makes you bulletproof in preventing death and hospitalization from any variant of the virus. When you see people wearing masks indoors, it's illogical. And I think right now you're seeing a political establishment saying, look, if we continue along these draconian guidelines that we put out, we're going to lose all the credibility of the public.
And I guess what you just said about deaths and hospitalizations is really the key, because I was going to ask, if they're still not 100% sure that the vaccine prevents transmission, then why do this now, especially with more contagious variants out there? But I guess the bottom line is, if you're vaccinated, even if you do still get COVID, it's just not going to have the consequences that it would have.
People have a completely distorted perception of risk right now in the United States, and the surveys are showing that even among vaccinated people, they don't feel safe not wearing a mask. And it shows how distorted that public perception is. Now, if you want to ask, what can we do better or differently, it's pretty clear to me that we've got to be in step with the American people right now. these guidelines are completely out of step.
Well, here's a hypothetical for you. Let's say I'm vaccinated, but I have an elderly person in my family who still isn't for whatever reason. Should I still wear a mask to reduce the risk of catching the virus and being asymptomatic maybe and passing it on to them?
Yeah, I think if you feel more comfortable with a very high-risk person at home who's unvaccinated or vulnerable, if adding that tiny added small percentage increase in reducing the transmission risk is something of interest, then I would say do it. The problem is we've got utility workers outside on the job on a hot summer day wearing a mask. We've got high school track athletes passing out from carbon dioxide inhalation toxicity from wearing a mask, and there's harm and no benefit. So if somebody has any concern and they want to wear a mask, go ahead. That's exactly how our society is supposed to work. The problem is so many people rely on the CDC for every single thing they do, and if they say something like kids have to wear a mask at outdoor summer camps, or a small group of people indoors, all of whom are fully vaccinated, have to continue to wear masks, then people see through that, and they lose a lot of credibility.
So now we've got certainly more freedom than there was, but they are still saying that indoors, in a crowded place, like a bus or an airplane, people should still be masking up, or a hospital for that matter. Is that clear enough? Is there fine print on masks now clear enough? And is that warranted?
So the reason they're doing that is because people who have to marshal masks at those places, at airports and at on buses, they can't tell who's vaccinated or not. So by asking everybody in those particular locations to still wear masks in a universal way, it avoids the issue of having to produce proof of vaccination. So it's really basically another option. Now, they're going to need to drop that pretty quickly. And the reason is because about 8 out of 10 adults in the United States have immunity. When you go to a restaurant, when you go to a sports event and you're sitting outdoors, when you're in a stadium, when you're at a meeting at the office, 8 out of 10 people are barriers for the virus to transmit or jump around. That's basically kind of what herd immunity is. And we've always said when you're at 70 to 85% of people in a location of a population that has immunity, you significantly reduce transmission. That's why infection rates are plummeting across the country today. And the reason I say 8 out of 10 and not 6 out of 10, which is the number of people who've been vaccinated, is about half of unvaccinated people have natural immunity from prior infection, something that the current administration and the CDC and Dr. Fauci are still very dismissive of and unfairly dismissive of. Natural immunity is a complete game changer. It changes the equation of how you get to population immunity, because if you don't acknowledge natural immunity, the only way to get to 85% immunity is through vaccine mandates and vaccinating every kid and demonizing those who are hesitant, even though some have a good reason to be hesitant.
We're about to have more people vaccinated because kids ages 12 to 15 are now allowed to get the Pfizer vaccine. Should children be getting it? What do parents need to know about that?
Well, look, I think a 12 to 15-year-old is physiologically similar to an adult. So I have no concerns with the vaccine safety, and I'm confident that it will be efficacious. For a kid who has a chronic condition, for example, a kid who is overweight, I would recommend they get it. We know that 78% of all hospitalizations are in people who are overweight or obese, and the remaining are in people with some other comorbid conditions. It's very hard for this virus. As I've said from day one of this pandemic, it is very hard for this virus to hurt somebody young and healthy. It's happened, but it's exceedingly rare. And so for healthy kids, the question is it worth getting it? I would say, as I recently outlined in the Washington Post in a piece with Nicole Sapphire, is there can be still a reasonable justification for getting a child vaccinated, even if they're young and healthy, because the systemic inflammatory syndrome still affects a lot of kids. There's probably been 10,000 cases of that in the United States over the pandemic. People get the infection, and then the kids get the infection. Then weeks later, they get this inflammatory response. If you saw that inflammatory response in the ICU up front and personal, it's not pretty. It can be painful for the kids, and it can have some consequences. So I'm not concerned about the risk of death in young, healthy kids, but there is a reasonable risk of inflammatory syndrome, which the vaccine can prevent.
Are they getting the same dose and expecting the same kinds of side effects as adults with the Pfizer vaccine?
The side effects, we really have not powered the study to look at the side effect profile, but we can use the extrapolation that a 12 to 15-year-old is physiologically similar to an adult, and they are with other vaccines. And in the early results from the trials, we know that the safety profile is very high. So it is dose dependent, it's weight dependent, and I feel confident in the safety of the Pfizer and Moderna vaccine in kids. I think it's really just a personal choice. I think most important, though, Lisa, we need to respect people's decisions. If they decide to get it or not get it, let's let it be their decision. We have to stop at every age level demonizing people right now as if they're the barrier to reaching herd immunity in the country. We don't need them because half of people unvaccinated have natural immunity from prior infection. We need to respect people's individual choices.
What are the chances, though, that mask mandates or similar guidelines could return this fall? How do we avoid having to mask up again?
I am concerned that they were going to see restrictions in the fall. Look, I have no problems if people want to choose individually to wear a mask in the fall because of a concern they might have or maybe risk factors. Maybe they just like wearing a mask. Let people do whatever they want to do. We probably can look to Asia and what they've been doing for the last few decades to say, here's a good practice. Wear a mask if you have any symptoms or you are around somebody with symptoms or you have risk factors or you're just concerned. Otherwise, you don't need to. And so you do see selective masking in countries around the world that have basically been practicing good hygiene during influenza. Asia got burned during SARS-1. During that pandemic, they learned that it's aerosolized virus, that it's airborne, and that masks help. That's why they've been wearing masks for a long time, and that's probably why they've done so well in many of these outbreaks.
This feels, for now, though, in the U.S., like turning a corner in this pandemic. Should it? Is that how it should feel?
Yeah, we are turning the corner. I mean, cases are plummeting, and if you look at regionally, the outbreaks that were happening mostly among younger people in Michigan, they've mostly resolved. I mean, Michigan is down over 50% in the last month. So we're seeing cases down across the board. Even in countries that are still experiencing outbreaks, we're starting to see those numbers start to show signs of turning over. So I think people should get good news. You know, I heard the CDC director say, you know, there's some good news, but the risk of variants could undo things. Why would you say that? People need hope right now, and there's no evidence that any variant has ever, any of the hundreds of variants, has ever evaded the vaccine's protective effect in preventing death and hospitalization. So I think people should be optimistic right now. I'm very hopeful myself.
Dr. Marty McCarry, thank you as always for your time.
Thanks, Lisa.
This is Tammy Bruce with your Fox News commentary coming up.
We're seeing the fewest weekly layoffs now since the start of the coronavirus pandemic shutdowns last March. 473,000 last week, according to the Labor Department. That's still nearly twice as many as before the coronavirus pandemic, and there are still more job seekers than job openings out there. President Biden says people should at least be looking for work.
We're going to make it clear that anyone collecting unemployment who is offered a suitable job must take the job or lose their unemployment benefits.
A lot of restaurant owners, for example, say they're short on staff because people won't take those jobs. Some Republican governors are trying to end any labor shortages by ending access to extra federal unemployment aid, $300 a week, next month. South Carolina Governor Henry McMaster tells Fox there are a lot of help wanted signs up in his state.
They're looking for people to work, and the people just won't come to work because they're getting as much money or more in some cases by staying home.
The White House says it's other factors keeping people home, but it's still a concern.
Oh, absolutely. I mean, and obviously the Biden administration is very sensitive to this.
Chris Wallace is the host of Fox News Sunday.
The president came out this week and said, look, if you get offered a job, you have to take it. Now, honestly, I don't know how they can know whether or not you've been offered a job, but it's an indication that they don't want people turning down jobs because of the very real fact that they can make, which just seems like a bad situation. You can literally make more money not working than working.
Yeah, I mean, so far, something like 11 states, as we speak, are turning down these enhanced unemployment federal benefits, $300 a week, in addition to the state benefits. Now, look, I've read several studies showing that getting unemployment aid doesn't discourage job searches, but I just can't square that for really low-paying jobs where you literally do make, close to or as much as or more than you were making before.
Yeah, no, it's a problem, and you do also have to say to yourself, when the economy is going at such great guns, or at least was until this last month, and you've got an annualized rate of GDP growth of 6%, do you still need these enhanced unemployment benefits? And maybe, yes, people might have to take a little bit less, and I can understand, it's easy for you or me to say, but on the other hand, the idea of getting people back to work and getting the economy going is a kind of virtuous circle that it seems to me you want to encourage.
Yeah. On the other hand, it's also industry by industry. If you were laid off from an $80,000 a year job, you might not want to go work at Starbucks, and you might figure I'm better off staying at home.
No, and there are other aspects as well. You've got the child care situation, right, which is that, some particularly women who've been really hard hit, who want to go back in the workforce but have to stay home for the kids, particularly if the schools haven't reopened. There are absolutely a number of factors in this, but you would hope that really smart people would sit there and try to figure out, what government policies, to a certain degree there are things that are beyond our control, but what government policies can we either continue, enhance, or cut out to get people back to work and, for good paying jobs.
Yeah. Speaking to the school issue, the American Federation of Teachers president now says, look, schools have to be open in the fall, 5 days a week in person. Kids 12 and up can get vaccinated now. So that should really help, at least by the fall. That's not going to help restaurant owners in the summer, but you've got to think by September, we're closer to fuller employment.
Look, there are obviously problems, and when you've had this severe a public health crisis and you've had this severe an economic crisis, you're going to see bumps. And, one of them, for instance, is inflation. I saw a fascinating study today that, there was this big bump in inflation, annualized rate of 4.8% in the last month. Well, in fact, if you did a steady curve or a steady graph, we're at 2% inflation from a year ago in March or April when the pandemic started to now. And one of the reasons you're seeing this big inflationary spike is not because the prices have gone up so much, it's that the prices went down a year ago, so it makes the prices seem higher.
Got it.
So, you have to assume that there are going to be some spikes. Having said that, it's pretty good news. One of the newsletters I read showed they do a map, and they have it in different colors. Are COVID cases going up? Are COVID cases going down? And it's a sea of gray, which is COVID cases going down in the vast majority of states around the country. And the only thing I would say in that regard is more people, please get vaccinated. I've done it. Everybody I know has done it. It's safe, reliable, and, we need to get back to normal. And then the more people that get vaccinated, the quicker that'll happen.
Let's moving on to the Middle East for a minute. The Israelis and Palestinian troubles are on fire again. President Biden happens to be in the White House this time, and he says we need to stand with the Israeli people. Some people on the left say that's too far, that we should have more sympathy for the Palestinians, that this is an occupation. Republicans say Biden's being too weak here. Again, it's a tough or no-win situation for any American president to be in. What can he do?
This is one, I know that there's this sort of talking point among Republicans. Oh, there are all these crises. And, there are. But to blame Joe Biden for what's going on between the Palestinians and the Israelis, to me, it would be like blaming Donald Trump and saying, wait a minute, Mr. President, you had the Abraham Accords. Why are we having fighting in the Middle East? You said that you'd put an end to it. This is a hot spot. It's been a hot spot for years. There's a lot of internal issues here. First of all, there's just the facts on the ground which is that the Israelis were going to evict some Palestinians from East Jerusalem. There was a fight on the Temple Mount of the Al-Aqsa Mosque. Hamas is trying to show that it really stands up for the Palestinians more than the more mainstream group Fatah. Benjamin Netanyahu was just about to be kicked out as prime minister in an opposition government. I'm not blaming it on any single person, but to say that this is Joe Biden's fault strikes me as absurd.
Yeah. Well, I wasn't implying that it was his fault. I just don't, again, know what an American president can even do here for all the reasons you just mentioned. It's all... For American presidents are supposed to somehow jump into the fray when these things happen.
Yeah, and look, you want to do everything you can to lessen tensions, to try to get a ceasefire, but, there are just facts on the ground, and, it is an occupation, and by the Israelis of Palestinian territories, and on the other hand, the Palestinians, there's an old phrase, I've never missed an opportunity to miss an opportunity. So there's enough blame to go around on both sides. And there are real limits to what any U.S. president can do.
Let me wrap it up with Liz Cheney. She's now out as the number 3 Republican in the House. I'm not sure, though, that many people who are not in D.C. politics or in our business much care. Chuck Grassley, Rick Scott have said that, seriously, not a single constituent has asked them about this, even Republicans.
Look, I'm not saying that I'm not going to say that they're not telling the truth. I don't know whether a constituent has asked. I think people care because I think that there is a real issue on both sides, incidentally, in the Republican Party about Donald Trump and whether this needs to be the Trump party or whether it needs to go back to first principles, because Trump took it in a lot of different directions when it came to trade, when it came to role in the world, a lot of other issues. And I think it's a real question, and people have to be concerned if for no other reason are interested. I think the question is to Donald Trump's hold in the party, which seems to be still pretty strong, but definitely not as strong as it was 6 months ago, if you believe the polls in terms of people that are very strongly for him, is interesting. We're going to be talking to Liz Cheney on Sunday. She's going to be our live top guest. And, one of the questions I want to ask her is, it's fine. I don't think anybody or most people have a beef with you having the feelings and saying what you have about Donald Trump. But when you're in a position of leadership and the Republicans are so close to taking back the House, do you want to emphasize the differences in the party, or do you want to emphasize the unity in the party when it comes to, taking on the Biden agenda? So, I think there are legitimate questions to ask Liz Cheney. I also want to ask her about her end game here. She's a very smart, resourceful woman, but if she has any thoughts about running for president against Donald Trump or the Trump base in 2024, that's going to be quite an obstacle for her.
Chris Wallace, the host of Fox News Sunday. Chris, we'll be watching that interview and whatever else you've got going on Sunday. Thanks for coming on.
Thank you, Chris.
Jason in the House, the Jason Chaffetz podcast. Dive deeper than the headlines and the party lines as I take on American life, politics, and entertainment. Subscribe now on foxnewspodcast.com or wherever you download podcasts.
And now, some good news with Tanya J. Powers.
National School Nurses Day was observed this week, and the state of Maine is making sure school nurses know they're appreciated. Instead of picking one nurse to give its School Nurse of the Year honor to, Maine is giving it to all of them. Governor Janet Mills, a Democrat, and the Maine Department of Education said Wednesday they and the Maine Association of School Nurses are recognizing all the nurses in schools since the pandemic has taxed resources at school districts throughout the state. They said school nurses have had to take on new responsibilities to help keep students healthy and schools safe. That's a point backed up by the National Association of School Nurses, which has more than 17,000 members nationwide. School nurses have been taking on additional duties during the pandemic, like COVID-19 testing, contact tracing, and giving vaccinations to students and staff members. So here's a big thank you to school nurses who are doing the essential work of keeping kids safe and healthy, which is good news. Tanya J. Powers, Fox News.
It's time for your Fox News commentary. Tammy Bruce. Tammy, what's on your mind?
People the world over have rejected the concept of a vaccine passport. because of the obvious violations of personal freedom and obscene government overreach. This hasn't mattered to the tiny tyrants running the global establishment, so they just use euphemisms when referring to requiring people to prove that they've been vaccinated in order to enjoy being allowed to participate in normal daily life. Case in point is New York State Governor Andrew Cuomo announcing new COVID-19 seating regulations for the opening of all outdoor venues like baseball stadiums. The vaccinated, the man whose COVID-19 policies are responsible for the deaths of at least 15,000 New Yorkers, tells us, will be allowed to sit in certain, quote, normal sections at stadiums without social distancing. The unvaccinated, however, will be segregated in different sections where there will be social distancing. Keep in mind, this is for people sitting in a massive outdoor environment. Moreover, everyone, regardless of vaccination status, will still have to wear a mask. As I noted on Fox Nation, this is effectively a vaccine passport, where if you're unvaccinated, you'll be sitting in the back of the bus. Keep in mind, this is about segregating groups of Americans based on whether or not they've complied with what the government sanctimoniously announces is best for you, even though there is no law requiring you to do so. The absurdity of this is stunning, and the media is reporting on it as though it is perfectly reasonable, and in the case of the New York Times, they describe it as a perk for the vaccinated. Too inconvenient to mention or discuss is what it means for the unvaccinated or those who refuse to reveal private medical information. This arrangement requires citizens to reveal to strangers either the government and or a private entity their protected and private health status. People who do not comply will be segregated, revealing to everyone that either you've chosen not to be vaccinated or you, in the eyes of tiny tyrants, are a troublemaker who refuses to cooperate. The ease with which Mr. Cuomo is resorting to segregation is more than troubling. It's dangerous and offensive. Black Americans have, for good reason, a level of concern and suspicion about the government making demands and issuing promises regarding health. The U.S. Public Health Service's, quote, Tuskegee study of untreated syphilis in the Negro male, end quote, which ended only in 1973, involved watching the progression of syphilis in black men while telling them they were receiving treatment when they were not. Bottom line, our government used black Americans as guinea pigs in a horrific medical experiment. After 40 years, it stopped only because a whistleblower exposed the scheme. Now, in progressive 21st century New York, we're being told that people who have refused to have an experimental vaccine injected into them will be segregated in a certain area, can only sit in a certain place, buy food from certain counters, and socialize away from other people, all because of who they are and their refusal to behave. We have a history of this, but it appears Mr. Cuomo could care less. These issues are obvious, so it's reasonable to conclude Mr. Cuomo is doing this to manipulate and shame people into getting the vaccine. We know this is a deeply personal decision. For each person, there are different reasons why they may be hesitant. Yet, with close to 50% of the American population being fully vaccinated, only the unvaccinated are at risk, and they can choose to adapt accordingly. The Cuomo administration has been exposed as not using science to direct the decisions and actions his administration takes. If he did, we would not have had the mass death COVID-19 catastrophe at nursing homes. All of the scandals he is facing are based on abusing people and abusing the power of his office. For a man who has not considered the death toll of his actions during COVID-19, why should we expect him to respect the civil rights of other human beings?
You've been listening to the Fox News Rundown. Stay up to date by subscribing to this podcast at foxnewspodcasts.com. And for up-to-the-minute news, go to foxnews.com. New from the Fox News Podcasts Network.
My name is Kennedy, and welcome to my podcast, which will, I humbly say, single-handedly save the world. You're welcome.
It's Kennedy Saves the World. Subscribe and listen now by going to foxnewspodcasts.com.